Hello, good afternoon.
Hello.
My name is Fernanda. I will be her doctor today. Hello. You're her son?
Yes.
So I need to make some questions for you. It's okay?
Okay.
Okay, good then. How old is she?
She's 74 years old.
74. Does she work?
No, she doesn't work.
She doesn't work. Okay. Where does she live?
She lives at Brazil on street, Lois Arcade Street, 155.
Okay. What is she complaining about? She has pain.
Yes, she has a lot of pain in right leg and difficult for breathing.
Okay. She's complaining about anything else? She had vomit, fever, pain.
Yes, she had
Tired.
vomited 2 times and she feels tired
Okay.
a lot and she has fever 38.8.
Okay. Does she is eating normally? She has appetite? No.
No, she's not feeling hungry.
Okay. Do you know when this pain started?
The pain started 3 weeks ago.
3 years ago. Okay. And when this pain started, she went to see a doctor?
No, she didn't see any doctor.
Okay. Did she take any medicine, painkillers?
Yes, she took anti-inflammatory.
Okay, for the pain, right? She had any trauma?
No.
No, she didn't. Okay. Did the pain started suddenly or without any reason?
The pain happened without reason.
Okay, without reason. Is she have pain in all other parts of the body or just in her right leg?
Yes, just relax.
Okay. And her problems with breathing, she had like for how many days now?
I think started 2 days ago.
2 days ago. Okay. In her childhood, she had any problem, any disease?
No.
No. She has gastric ulcer,
No.
allergy,
No.
blood transfusion.
No.
Did she smoke?
No.
She is addicted to some kind of drug. She drinks alcohol.
No too.
No. Okay. Does anyone from the family had myocardial infarction? Her parents maybe or anybody else?
Yes, her parents.
Her parents, okay. She has diabetes?
Yes.
Right? Okay. She took any medicine?
No.
No. Okay. She had any operations?
No.
No. Tuberculosis she had?
No.
History? No. Does she had any stroke before?
Yes, it happened 2 years ago.
2 years ago. Okay. Myocardial infarction she had?
No.
No. Okay. So thank you for your information. We will do some exams in your mother if it's fine for you. And after, if I need, I will talk with you again. Okay?
Okay, thank you.
Thank you so much. So now to do the objective examination of our patient, we will look to the general condition of the patient. In this case, we can see that the patient is a severe condition as she's not answering me. She's feeling confused. So you may say that she has a severe condition. To her age, we can see that she looks older than the normal in the appearance. Her skin is kind of grayish in the yellowish. Okay, her characteristic of the skin. The temperature is still high. She has fever 38.8. And now we're gonna use the Glasgow Coma scale to see if our patient in which condition the patient is. So to do this, we need to see the opening of the eyes, and first I will see if she opens her eyes spontaneously, and she, as we can see, she's not open. So I'll talk with her and she will open the eyes. Lady, okay, she opened. So now to analyze the motor response of the patient, you need to do some steps. The first step is to try to do a verbal command to the motor response. I will try to ask her to raise her hand up. Lady, can you please raise your hand? She didn't raise, so we step on to the next step. that is the localization of painful stimulus. I'll try to press her muscle here. As you can see, she has a response. So we analyze that. And now for the verbal response, we need to try to talk with the patient. So first step of the verbal response is to see if she's able to talk with me. Lady, how are you? Are you fine?
It's my home.
Okay, as you can see, she didn't understand that I asked her if she was fine. She faster answered me that if she was her home. So we can say that the patient has inappropriate words to communicate. So analyzing the scale, we can see that the patient has a severe condition because the result of this, the sum of the numbers was 11.
Performing the inspection of the respiratory system, we were able to see that was shallow, noisy, presents retraction with a respiratory rate of 30. During palpation, there was no pain, only vocal fremitus in the lower parts. During percussion, we noticed a dullness in the lower part. During auscultation, we could hear wheezing and crackles in the lower parts. During the cardiovascular inspection, the pulse rate was irregular 120. The auscultation showed us a muffled sound, without murmurs and rubs. While performing the inspection of the GIT system, we identified that the patient was with dry tongue, bad odor, without herniation. During auscultation, no sounds could be heard. Sleep presents normal size, a liver was enlarged. When performed digital rectal examination, we noticed presence of blood.
For clinical signs of her disease, as we can see here, she has a gangrene, very necrosed leg. We can see that her right leg is all black to the knee from the foot. She doesn't have any sensation in this leg due to the necrosis part. We tried to localize her femoral pulse. We couldn't. We tried to see her popliteal pulse. We couldn't also. And her post-tibial pulse, we couldn't also find it. And the pads also, we didn't find anything. So
Our patient case is that she presents thrombosis in right leg arteries, hepatomegaly, presence of inflammation, respiratory problems, also cardiovascular problems and GIT bleeding. In blood test we noticed that AST levels were high and also ALT, both of them may inform us about the abnormal function of liver. We also saw that concentration of bilirubin was higher than the normal, with low concentration of white blood cells, high erythrocyte sedimentation rate, low red blood cells and hemoglobin, and hematocrit was high also. For a better diagnosis we may order for the patient plain chest, Ray, US of abdomen, CT of abdomen and blood culture. As treatment the patient should not do exercises, diet must be in PO, perform infusion therapy, oxygen therapy and perform a surgery of amputation of the right leg.